Edema is an inevitable factor in tissue injury. In most cases, the transition from the initial insult through the healing phase goes without problems. Sometimes, however, the edema is so great that it hinders the healing time, and the ability to influence that healing time may be desirable. This brief synopsis of the pathology of edema is to clarify the rationale for the use of the lymphedema compression garment and devices to aid in edema reduction. Edema and inflammation due to tissue injury have most of the same fluid dynamic properties as lymphedema, whether it's from strains or sprains, wounds, or surgical intervention. The flooding of inflammatory proteins such as cytokines and albumin in the interstitial fluid is a natural response to tissue insult. This causes an overabundance of interstitial fluid at the capillary level, and if not quickly absorbed or transported out of the injured area, edema and inflammation will result. Increased capillary permeability from injury occurs because various proteins such as cytokines, vasodilatory prostaglandins, and certain isomers of nitric oxide are present. These factors influence the increased capillary response and increased lymphangiomotoricity of the lymph vessels. The presence of excessive proteins in the interstitial fluid pulls more water into the interstitial space. These protein molecules are large and are only transported from the interstitial fluid through the lymphatics, where a garrison of lymph nodes acts to destroy debris, bacteria, viruses, and excess water. The lymph nodes act as a sewage treatment plant for the body. Ultimately, the lymph fluid will return to the central circulatory system after it has been filtered. If, however, the injury response overwhelms the transport capacity of the lymphatics, swelling will occur and can delay or hinder the healing process. In treatment, the lymphatic system responds to manual stimulation, compression, exercise, and skin care. Interstitial fluid and the excess proteins can be mobilized at the capillary level with the following combination of skilled techniques. Manual lymph drainage is a combination of specialized skin techniques which will increase and improve the integrity of the existing lymph structures. External compression is applied by means of day and night compression garment systems to increase transport capacity through the lymphatics and resorption through the central circulatory system. Participation in exercise while in compression garments or bandages promotes lymph drainage due to the effects of the muscle pump. In sports injuries, post-operative procedures, and wounds, the lymphatic system is functioning properly, but becomes overwhelmed at that capillary level. When the initial flood of activity occurs, it's best to prevent the overwhelming effect of the injury by treating the injury with edema-reducing techniques. Lymphedema techniques are very effective when primary dysfunction is at the capillary level, not throughout the lymphatic system, such as the case with a lymphedema diagnosis. JoViPak rehab garments are designed as a compression system to aid in the mobility of lymph fluid to promote and accelerate healing and thereby restore function quickly.